Now, lifestyle advice, this is, I guess, the hardest part, because all the best things in life seem to be bad for the body. So you have to choose what you want to do appropriately. Unfortunately, a lot of people, when they're younger, they think they're invincible. They can take on the world, everything can do. So by the time they grow older, when things stop working, they feel regretful. But lifestyle change, whatever your age, will make a difference, even if you have cancer. So there are some studies that show that if you have cancer and you start, let's say you're on chemotherapy or some toxic drug, if you're strong enough, if you feel good enough, with some of the new targeted therapies, people will go back to work. Those who exercise survive longer than those who don't exercise. So it doesn't mean when you get cancer it's too late, I shouldn't change my lifestyle. But unfortunately, those people who do change lifestyle is only after they get cancer, right? So the key thing is to change it before you get it. So how can you reduce it? These are all guidelines that you find everywhere, very common. Engage in physical activity. Many years ago, it was just 3 times a week. Now the general advice is you got to do something vigorous enough to increase your heart rate. It doesn't have to be running or cycling, even walk, brisk walk, for at least 30 minutes, 5 times a week. So 30 minutes sustained activity helps reduce your cardiovascular risk, and by virtue of that burning some calories, you reduce risk of obesity and risk of many of the cancers that have been shown. Okay, so if there's an opportunity for you to walk from MRT to a certain place instead of cab, or I know it's very hot, but if there's any opportunity to do exercise, unfortunately some patients take it that if they feel tired at the end of the day, it's exercise already. I'm a housewife, every day I cook, I wash dishes. Exercise what? What else is there, right? Or I do gardening. My hobby is gardening. What kind of brisk walking do you do in gardening? You sit, squat in one spot and chunkle and plant, right? It is exercise, but you don't burn as much calories. Your heart rate doesn't go up to a rate where it's going to be helpful for you, right? So eat healthy. Again, 5 servings of vegetables, fruits. Cut down salt. So these advice, if you think about it, very similar to the advice given to heart patients. So heart health is also good for cancer health as well. Okay, choose your food wisely.